Welcome to the deep dive. Today, we're tackling something that might just reframe how you view your own well-being. We're
Mm.
diving into Gary S. Becker's paper, Health as Human Capital, the mission. Show you health isn't just, fixing problems, it's an investment, like education.
Exactly. Becker really flips the script on
Yeah.
health. It's not passive, it's an active asset. And thinking that way, well, it uncovers huge economic value, connections we just don't normally see. It's way bigger than just healthcare systems.
Okay, so let's unpack this. One really eye-opening idea is the statistical value of life.
Right.
Now, this isn't about putting a dollar value on you. It's an economic thing, measuring what we're willing to pay to reduce mortality risk. And, well, the numbers are big.
They really are, surprisingly so. For a younger person in the U.S., you're looking at estimates like $3 million, maybe $5 million.
Wow.
And what's key here,
Yeah.
what's really fascinating, is most of that isn't lost wages. The old way of thinking.
Right. The purely economic output.
Yeah. So in one calculation, maybe lost earnings are a million out of, say, 4.4 million total. The rest, that's mostly the sheer value, the utility of living.
Utility of living.
Like leisure time, time with family, friends, just enjoying life, the full experience. That's where most of the value comes from in these calculations.
Okay. So health is this valuable capital. How does it connect? How does it influence other parts of life? The paper talks about complementarities.
Right, complementarities. This is crucial. It basically means progress in one health area creates knock-on benefits or incentives elsewhere. It's interconnected.
Okay. Give me an example.
Sure, think about fighting diseases. When we made huge progress against, say, cardiovascular disease back in the late 20th century, that actually boosted the incentive to fight other things, like cancer or Alzheimer's. Because suddenly people expected to live longer, there was more life, more healthy years to gain by tackling the next threat.
Right. The potential payoff from curing cancer gets bigger if you're less likely to die of a heart attack first.
Exactly. And it goes beyond just diseases interacting.
How so?
Well, think about health and other kinds of human capital. Education, for instance.
Yeah.
If you expect to live longer, investing in education makes more sense.
Or yeah, the payback period is longer.
Precisely. Costs are up front, benefits stretch out. Longer life means bigger returns on that degree or training, and it even shapes habits.
Habits, like diet and exercise.
Yes, but even more broadly, healthier people, people who expect to be healthy longer, tend to develop good habits, exercise, maybe religious practice, things linked to well-being, and avoid bad ones. Smoking, hard drugs.
Why?
Because the long-term costs of those bad habits just loom larger if you think you'll live to 80 instead of 60. Becker mentioned soldiers in Vietnam using drugs, but they cut back drastically when they came home. Why? Their life expectancy, their expected future, shot way up. Suddenly, the long-term consequences mattered more. Healthier people also tend to have lower discount rates. They value the future more.
So they save more, invest more.
In all sorts of things, yeah. Including their own future health and skills. It's a virtuous cycle.
Let's zoom out then. Population size. How does that play into medical progress?
Well, medical innovation is a classic case of increasing returns to scale. Meaning the bigger the population, the benefits, the bigger the total value, and the bigger the incentive to innovate in the first place. The numbers are just staggering. Between 1970 and 2000, the value of reduced death rates in the U.S. alone, estimated around $60 trillion.
60 trillion.
Yeah, and across the OECD, the developed world, maybe $190 trillion. The huge value driven by millions and millions of people living longer. It explains why research shifted.
Shifted how?
Early 20th century, lots of focus on childhood diseases. Latter half, more focus on diseases of aging. Because, well, that's where the larger affected populations were. More potential beneficiaries, bigger market, stronger incentive for R&D.
That scale is incredible. But it raises a question for me. We see all this progress, this focus on health, yet we also see things like rising obesity rates. How does that fit?
That's a really interesting paradox, isn't it? One thought, and Becker touches on this, is maybe our anticipation of future medical fixes plays a role.
Like expecting a magic pill.
Sort of, yeah. If you think, oh, well, they'll invent something amazing to deal with the consequences of being overweight or diabetes, maybe that reduces the immediate disincentive to engage in some unhealthy behaviors now. It's a complex psychological and economic interaction.
Okay, last big piece here. Global inequality. Usually we measure that with GDP per capita, right? But this health perspective, It changes things.
It really does. If you factor in the value of increased life expectancy, especially how much faster mortality rates fell in poorer countries compared to richer ones, particularly since around 1960.
Well, that is.
Well, global inequality has actually converged. It's shrunk, much more than just looking at income figures would suggest. Poorer countries often adopted health knowledge and technologies from richer ones relatively quickly. So the health gap closed faster than the income gap.
So the big picture then, this deep dive really shows health isn't static. It's dynamic capital, deeply tied to choices, education, habits, even global economics.
Absolutely. It forces you to see connections everywhere. Which leads to maybe a final thought for you to consider.
Okay.
Given these huge economic forces driving medical innovation, this expectation may be that science will keep pace.
Mm-hmm.
Are we, as a society, getting too comfortable expecting medicine to always bail us out from our behaviors? And what are the long-term risks if we rely too much on that future promise?